Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're going to be talking about a key secret exercise that you can do throughout the day known as the collarbone lift to help reduce the compression and irritation on your degenerative, herniated, and bulging discs. Hope you enjoy. So one of the easiest and most effective tips is a simple exercise that can be done all day long that I teach my patients and my personal training clients alike for degenerative, herniated, and bulging discs. And that's known as the collarbone lift. I'm going to let you in on this little secret that if you focus on the posture and position of your collarbone, it can have a great effect in terms of the damage and the resultant forces that go into disc problems. Lower back discs are generally aggravated the more flexion that we have. Flexion, or bending forward on the lower spine, produces a compressive force on the front of the spine, which pushes the fluid or nucleus in this disc outwards towards the periphery, aggravating herniations or bulges. Many times, patients, personal training clients, will be going through their day, they'll be feeling okay with their back, no big problem, and they'll go to bend over and do something, and all of a sudden, oh, I know I shouldn't have done that, that aggravated my back. The secret to this simple exercise is practicing, and this exercise is one of those things that you can do without sweating. It's a simple little maneuver that goes a long way in preventing disc problems, is simply keeping your collarbone tall. Now what I mean by that is if you look at the curve in my lower back where my hand is, normal standing posture, the collarbone is elevated as high as it can be. It floats my whole spine from my tailbone through my head in an elongated vertical way. When my collarbone drops, you'll notice my hand starts to flatten. I start to lose that arch in my back. I compress the disc. This will happen whether I'm standing or whether I'm sitting. Sitting postures typically are worse on the disc because when we sit, we can put 12 to 13 times our body weight on the disc. And if that's associated with allowing our collarbone to slump down, it creates a lot of compressive force. Disc pain many times is a repetitive force generated pain, meaning that it's not so much we do one thing and we hurt our backs, it's the building up of small repetitive forces, including flexion through the day, sitting at desks a long time, working in a stooped position where the collarbone drops and that arch in the lower back starts to decrease. So what you're going to practice at the beginning in both seated and standing positions is just keeping your collarbone tall. You do that when you sit, stand, walk. When you go to bend, you're going to use a hip hinge where you bend from the hip joint and your knees to get down to where you need to be. You notice I'm not dropping my collarbone. My collarbone is still tall in relation to the remainder of my spine. When I have that collarbone drop down, that's going to be my problem. That's flexing the spine, aggravating my lower back. Keeping the collarbone tall helps me. When I need to go down to something that's not right ahead of me, I need to twist and bend through the day. As I'm going down, if I'm allowing my collarbone to sink, that again creates flexion on my spine. Flexion with a twist or rotation is a very hazardous motion for many people with disc problems. But by keeping my collarbone tall as I twist, it helps to maintain that arch in the back. Again, I'm thinking collarbone up in relation to my pelvis. So whether I'm standing or sitting, the vertical height is here. If I'm hip hinging or squatting, my angle is here. If I'm lower, my angle is here. It's always keeping the collarbone tall and away from the pubic bone. When my collarbone drops towards my pubic bone, we create flexion in the low back and many times aggravate disc pain. If you include this little collarbone lift throughout the day, keep in mind where is my collarbone, keeping it tall. Many times, patients and clients with degenerative, herniated, and bulging discs at L5-S1 and L4-5 will notice that their backs will feel substantially better throughout the day. And when you do get aggravated, you start to notice, what motions did I make? Was my collarbone falling down? Putting two and two together. This simple posture exercise can go a long way in relieving degenerative disc pain at L5-S1 and L4-5. If you like this video on preventing degenerative disc, herniated, and bulging disc pain through posture changes, feel free to subscribe to our channel. We got a lot of great videos out there to help you formulate a good routine and build a conditioning program that supports your spine, helps stabilize it. If you're looking for a more in-depth program that's customized for your body, look no further than our Fast Track program for degenerative disc disease, available at the posturesize.com website and the painfreeandfit.com website. And as always, if you have questions or comments, write in. I'll do my best to answer them. For those of you who want me to customize a routine for you, all you need to do is contact me through either of those websites, and I'll be delighted to get together with you online to discuss how we can formulate a program to help stabilize your lower back. I hope this video on the collarbone lift secret helps you with your degenerative, herniated, and bulging disc condition.